Now to some more stories. Ghana's fight against COVID-19 was indeed challenging, especially with the backdrop of corruption scandals. Despite these challenges, the government set up several systems to combat the pandemic, including the scramble for vaccines to save many. Sarah Penkro has been finding out the lessons Ghana has learned from the management of COVID-19 5 years on.
By July, Ghana's COVID fight had reached its tipping point. Health infrastructure was constricted, and the country was on the hunt for vaccines. As with the lack which has defined events, the country would be the first sub-Saharan country to receive the COVID-19 vaccines from the COVAX facility. Receiving the shots at the initial stage was a challenge for many Ghanaians, as misconceptions about its after effect dominated conversations. Names like Johnson & Johnson, AstraZeneca, Sputnik V, Moderna and Pfizer became commonly used words.
I don't want to take the vaccine because I don't know where the medicine is coming from. So that I can't take my life to danger place.
For me, I will not take the COVID-19 vaccine because I've not had enough education about it.
There was a rush for the vaccines, especially when we got the first 600,000. I remember I came on the 24th of February 2021, and we were very excited. But after the first 600,000 doses were deployed, we didn't get the additional doses that we needed for the second dose and so on. And that is when the hesitancy started. But largely, I think that as a country, we fared well, considering the fact that within a period of 3 years, we had vaccinated at least 16 million persons.
The country's healthcare system was undoubtedly stretched, and the COVID-19 task force could only give nothing but their best.
Everybody came together to work together to make sure that our response as a country saved more lives than we lost. It is sad remembering the patients and the citizens, the friends that we lost.
Many holding centers were activated at various hospitals to manage patients. And the lasting legacy from the pandemic for many Ghanaians is the Ghana Infectious Disease Center, the country's first and only of such facility.
5 years down the line, there are no COVID patients on admission here, even though the place is still being used to treat infectious diseases and has some few patients on the other wards.
Kudos to all the Ghanaian healthcare, especially those in the ICUs. They were stressed because working in that Tydex suit for 5 minutes is stressful. But to stay in sometimes an hour, sometimes 2 hours, just to make sure that the critically ill patient gets some cure, they are the people we should doff our hats to.
5 years on, not everyone has moved on from the trauma. Dr. Segu, lead testing of patients, recounts what their greatest fear was during the pandemic.
My team members, they were my headache. I did not want any of my team members to fall being infected.
Public education, enhanced surveillance, and contact tracing intensified. Preventive kits would be highly sought after, with prices skyrocketing. Ghana's COVID story, as with all other things, would have its fair share of corruption. A special audit by the Auditor General would reveal that the outbreak of the virus created avenues for persons to rape state coffers with a justification at the time being, we are not in normal times, by government officials, served as an excuse to circumvent procurement regulations. The Sputnik V vaccines procurement scandal, among many other scandals, cannot be easily forgotten. But as a country, how have we fared 5 years on?
We did not do the post-COVID review. And if I ask you today, what was the major thing that we did during the COVID? Your answer would be Agenda 111. But if we had gone back to reflect, we would have realized that going into hospital was the cheapest and easiest means. The problem was how to find the disease. We have not invested anything post to improve on our surveillance.
It definitely was a difficult moment for most people, but for the frontline health workers, would they be willing to offer same sacrifice again if the need be?
Even the citations that were issued out to frontline workers, I can say boldly that GIDC staff were left out.
None of you got a citation.
And I think the hurt is still there, especially those of us who began GIDC with COVID. We think our efforts have not been well appreciated.
Though so many things happened, which to me as the lead of the laboratory to GIDC, it was not desirable. However, by my speciality, I will do it again.
COVID was difficult. It was very difficult, and to tell you the truth, the basic thing for me was even sometimes some just basic insurance. We didn't get some of them.
People have felt maligned because if there is another pandemic, I bet you, we will struggle to look for healthcare workers who will respond to country. They will respond to God, but for country, I doubt that the people are ready to respond.
It was a significant moment in the life of every Ghanaian, and the selfless acts of all frontline workers cannot be overlooked. But have we fared well as a country in appreciating their work? Posterity will indeed be the judge.